This is MasonWebTV, powered by HCC.
Hi folks, Diedrich Allen with MasonWebTV, powered by HCC. Recently, I had the opportunity to sit down with Scott Hilburn, retired Public Hospital District No. 1 Commissioner of Mason County, Darrin Moody, retired police chief who has been appointed to fill Scott's seat on the governing board for Mason Health, Mason General Hospital, and Mason Clinic, and Eric Moll, CEO of Mason Health. Let's listen in. Well, big changes for Public Hospital District No. 1, the governing body for Mason Clinic, Mason General Hospital, Mason Health overall. And with me from, well, let's see here, left to right, Scott Hilburn, retiring, or retired.
Yes.
Darrin Moody, new guy as he's calling himself, and Eric Moll, CEO. And I guess I want to start with Scott. Retirement number, what, 3 for you?
Yeah. In recent history, it's number 3. Right?
Okay. So what prompted this latest?
Oh, Diedrich, this was really a good time for to step back and let somebody else come in with new ideas, and I'm really thrilled that Darrin is joining the team. If you're going ahead and stepping aside this way and moving into your retirement, it's nice to go ahead and know that somebody's got the same support of the institution and the community that I enjoyed. So I'm just tickled to death to have Darrin on board. In fact, I was up at the clinic today, getting my eyes checked, my annual eye check, and they come in, they don't say, "Congratulations, Scott," they say, "Hey, Darrin's awesome!" So yeah, I feel really good that we've got a good solid replacement on board.
So what is next for Scott Hilburn?
Well, the standard answer in this type of situation is I'm going to travel, right? So Karen and I are going to travel. I'm going to spend some time with her, supporting her fund. There's more and more women in Mason County right now that need more and more financial support for their cancer treatments. So it's getting to be a big piece of her life, and if I could go ahead and support that a little bit and help her, that would be beneficial. We've got 8 grandchildren spread all over the state, and we haven't really been able to travel too much during the last 10 years or so. I felt my feelings, not any that the administration put on, was that I wanted to be available pretty much Monday, Tuesday, and Wednesday. And Thursday, Friday doesn't give you much time to travel. So we're looking forward to doing that, seeing our grandchildren. So when are you going to ask me if I'm running for another office?
Oh, that wasn't on my list, but I will in a minute, now that you put it there. Moving to Darrin, you just retired from being a police chief.
I did.
Ran into you in the grocery store.
Retired number 2.
Ran into you into the grocery store the other night, and you said, my retirement didn't last very long, did it?
But I will say retiring and getting to grocery shop during the day is the best part of it. Okay, you don't have to go on the weekends.
Right. So what attracted you to the hospital board?
Scott's pretty persuasive. If I say he strong-armed me, that probably wouldn't be the right term. But Scott and I have known each other for years, and Eric and I have known each other professionally. And Scott called me up and said, "Hey, I got an idea." And we talked about it for a little bit. I talked to Eric about it for a bit. And it was interesting. One of the things that convinced me it was okay and a smart thing to do at the time was I talked to Dr. Gushy at the hospital. And Dr. Gushy said, "You know what? You're going to bring a perspective to this that we haven't had. You're going to bring a perspective of public safety and reality on the streets that we haven't had, which will be an interesting combination." And in the end, I told Eric, it's public safety. Fire, police, medical, it's all public safety. So,
well, that goes right into my next question. What are those transferable skills from law enforcement?
I'm sure there's going to be transferable skills, but for me, it's more of learning. Like most people, I see the hospital from the outside. I see the hospital as a customer, or I see the hospital as a professional working relationship. It'll be nice to see the inside of what goes on and get those why questions answered that we all have.
Eric?
Yes.
You told me no hard questions. But I got to ask you, how was it working with Scott?
So Scott,
Wait a minute, cue card?
yeah. Scott is awesome on so many levels. He was an incredible thought partner for me personally. He cared deeply about the community. He cared deeply about Mason Health. So it was always what was best for the community, what was best to make Mason Health a better organization, improve quality, keep it on sound financial footing. And so, I mean, he just put his heart and soul into that. And so to work with someone who's that engaged, that passionate, it was absolute privilege.
And what do you think that Darrin's going to bring to the table?
Well, Darrin already said it, and that's something I've been thinking about is Darrin brings that public safety perspective. I think he's similar to a recent commissioner that's joined the board as well, Gail Weston. Gail brought this very strong community and financial background, and it's just been so complementary. The kinds of questions and how she leads in her governance. And I think very complementary to that. I see Darrin, bringing that patient or that public safety, that community perspective as well, and in a different way, so that challenges the organization, challenges leadership, senior leadership. I think also he really understands the importance of, in a public entity like Mason Health is a public hospital district, he understands the need of transparency and being accountable to constituents, and so I think that also is going to bring a lot of strength. So looking forward to working with Darrin for sure. I'll miss Scott. I'm going to miss Scott. I have to say that.
So Scott, back to you. In your years on the hospital board, 2 separate times, is that correct?
2 separate.
What has been accomplished, and what are you most proud of?
Whoa. Anticipating that question, I brought...
He's got it scripted out for you, Diedrich, okay?
Exactly. I'm not trying to go ahead and brag too much. This isn't about me. It's about the organization and Eric's leadership. But let me go ahead and answer a couple of those questions for you. First of all, we started out with a brand new surgery wing, state-of-the-art. We'll have physicians coming over here from Olympia and going into our surgery suites, and they go, wow, this is awesome. You guys did a great job. We expanded our medical team, our providers, by 15 new providers. To accommodate that growth, last February
2020.
Okay,
Seems
yes.
like a decade ago, but just a little over a year ago. Yep.
We opened Mason Clinic, which gave us an increase of 31 additional exam rooms. Awesome. So that really opened it up for the public to be able to come and make a phone call and say, hey, I need, now we've got providers, and now we've got the capacity to go ahead and see them with these additional exam rooms. And everybody's together. Before we were spread out over here, over there, down the street. Now it's going to be, as soon as this COVID thing gets knocked down a little bit more, in one central location, which benefits the public and the patient. A real burning, driving, what else can I say, issue was quality. Mm-hmm. I wanted us to go ahead and be able to walk down the street and see anybody go ahead and say, I was just up at your ED, I was just up at this clinic, and it's outstanding service. Excellent, you fixed my problem, thank you. So I'm pleased to see that Eric, and I were lockstep on that issue. We started really focusing not internally within the organization, to the point, not once but twice, the Washington State Hospital Association recognized our little hospital here in Shelton having the top quality in the state. I mean, against all the big guys, everything. This was just, quite a tribute. But 1.5, 2 years ago, we entered into a new relationship with Kaiser. Mm-hmm. So our patients that were on Kaiser in the past had a hard time being treated here. Kaiser went and said, hey, come over to Olympia. Now they're going in and saying, hey, you guys are doing it all right. We want you to be part of our team. So those kinds of patients now can come to Mason Health for care. I'm really proud of how our staff responded to COVID-19. It doesn't sound like much. You know, you got to set up a parking lot, and you've got to do this, and you've got to do that, advertise or whatever. But behind the scenes, all these people had other jobs within the organization that we expected and the patient expected them to do. So it was quite an orchestra, it was quite a ballet, but they did it well. You know, I can't go into the grocery store without somebody coming up and saying, hey, I was up here a couple weeks ago. Well, I think you were at the school.
I took my parents through the drive-through clinic that the hospital and the county partnered on, and I remember calling afterwards saying it went off without a hitch. I went to another clinic where literally we were standing outside for an hour and a half. Here we were in a car, comfortable, and within the hour we were vaccinated on our way out the door, both times.
And that speaks again to the organization and the commitment that our staff had to addressing the problem. We have a couple new partnerships which Eric was able to go ahead and establish. One is with OOA.
OOA.
Olympia Orthopedic Associates.
All right, I'm just, you know.
Yeah, thank you. Stop us from acronyms.
Yeah, Olympic Orthopedic Associates, and also some of the urology folks that are over there coming our way now. So once again, we expanded the services right here in our community for healthcare issues. So we're really proud of that. Eric has worked really hard again at behavioral health. We have 5 now?
7.
7? I
Well,
leave and you hire 2 more.
recruiting a 7th. We have 6. Recruiting a 7th.
I leave and what you do. Put another couple. Great, we need them. The community needs them. Maybe when it's your turn, I quit clowning around. You can talk a little bit about our behavioral health and some of the goals for that area. But to sum it up, when I joined the board, even the first time, we were a good community hospital. Now we're a leader in Lower Puget Sound in the region in healthcare. And that's just hard to fathom how this small little entity over here could go ahead and reach that type of quality indicators, be able to go ahead and track that kind of positions right here in Shelton for our patients. So that's what 15 minutes later, that's what I'm proud of.
So, Darrin, it sounds like Scott's done all the work. What's left?
That's it. Now it's cruise control, right? No, I remember having the conversations with Scott and with Eric, saying, "I'm not Scott. I just don't know that I could give you that level of service to the community." And they said, "We don't expect you to be, but bring a perspective to the board and see what it's all about." And that's what this was. It was let's see what it's all about. Let's lift the curtain and go and see what we can do to move forward in the community. And in just the last years that I've been here, which is a relatively short time in the window of things, the hospital leaps and bounds from where it was 6 or 7 years ago. And with everything going on in the community, with the YMCA, the schools, the hospital, I mean, Shelton's moving, and I think it's a good time.
So pretty much the same question to you, Eric. Future.
Yeah, I'm very bullish on Mason County's future. I think it will continue to grow, and I don't think it's going to grow in a way that people that are attracted here, are going to, find unpleasant. I think it's going to have a very nice, sustainable growth, and so I think for Mason Health, there's 2 things. One is, continuing to expand and increase services and create access for folks locally, and so. There's a number of ways. Right now, Scott mentioned behavioral health. We'll continue to expand and integrate behavioral health. I just want to do a huge shout out to Dr. Maurer, Jennifer Anderson. There's a whole team and our behavioral health specialists. they're so committed to finding ways that they can continue to integrate and expand that service, and I think it's going to be very valuable. So I think that, and then as we look to say, well, how can we also help the community? One thing is certainly part of the vision is how do we expand local access to oncology? Very, very important, and so can we help people receive more of their care locally, because it's such a difficult time for folks to go through. And we have great partners. Vista Oncology is a great partner. They do a lot of work in the community, and so there's various ways I think we can look at how do we continue to expand oncology. And then Darrin mentioned Mason County Public Health, and they have a small team, but they punch way above their weight. Very, very good team, led by the executive director there, David Wyndham. He is a really, really strong public health leader, great partner, and he has a vision. He's like, he cannot wait, to get a little bit further, from beyond the pandemic. He has an exceptional vision that I and Mason Health want to support, partner, collaborate with him 100%. So I want to give credit to David and his vision for how can we increase overall public health, address things like diabetic care and do it more on a community-wide basis. And so he has a great vision, and we're looking forward to rolling up our sleeves and partnering with him. So how can we work with public health to improve the overall health of the community? So I think that's going to be a big thing as we go forward. There's embarrassment of riches, in my opinion, of leaders in Mason County. So I also want to acknowledge Bo Bakken and Fire Chief up in north part of the county. Bo has for the last couple of years has led a coalition around the opioid issue, and so how do we also, from a public health and health of the community, how can we continue to tap into the momentum and and kind of all of these different parties coming together in the county to try to make things better. So yeah, I'm really excited for the future.
So I'm going to ask the three of you the question that's last on my list here, and we'll start with Scott.
Okay.
What do you see coming for Mason Health?
I'm sorry, see coming what?
What do you see coming? Well, let me put it this way.
All right.
What would you like to see?
In the community?
In the community, the hospital.
My personal life?
Let's stick with the hospital. We don't want to get too personal here.
Oh, that's that's a good question. One you didn't tell me you were going to ask in the future. Eric has brought a new vision, new leadership, new energy to the process of the leaders, the executive team at the hospital. He is focused on looking down the road at a vision, having a plan to get to that vision, and having the financial ability to support that plan. So there's nothing but great things going to happen. That's why I got off at this point in time. I wasn't leaving anybody in a big hole and say, good luck, Darrin, pull yourself out of this. Things are going well. It's a fun time to be a commissioner. I need to go ahead and thank my two fellow commissioners, and Nancy Truxas, who was on the board with me for a while too. But Don Wilson and Gail Weston just made it a joy to serve and go through this process. Yes, there's a lot of technical information. Yes, you got some homework to do. But when you see the results in the end, positive things happening, it makes it all worth it. So I was just tickled to death that Darrin was able to go ahead and slide in, as I said earlier, into my slot. But also, as a footnote, when I was mayor, I worked with probably 3 different police chiefs down there at the city. And I've got a little bit of knowledge what a good police chief is and what a so-so police chief is. Darrin is awesome. He brings the skill, he cares about his people, he cares about the community. So again, Darrin, I'm tickled to death you're here.
Thank you.
And now remember, you can't bring the gun in.
Yes. Yes.
So Darrin, what do you see coming for Mason Health?
Well, you know, Eric touched on it a little bit, you know, with partnering with the county and things. And you know, since I got here, it's been about partnerships. Mason County itself, and especially the city of Shelton, is too small to handle things on their own. The resources just aren't there. And I see that for everywhere. And, you know, the YMCA's open space for the hospital, or for Mason Health. And those partnerships are going to be the stronghold that's going to help Mason County. You know, if the hospital just started shutting itself in and saying we can do this all on our own and we don't need help from anybody, they're going to strangle themselves. And, you know, and it hasn't been like that, and it just keeps growing. You know, there's so many smaller clinics around the area here that are now part of the team. And like I said, I just see the city, the county, and overall health just being a partnership and keep growing that way. You know, like Eric said, there ain't a whole lot of space to grow in Shelton. Right. You know, but that doesn't mean you can't grow otherwise.
And Eric, I know you've touched on this in the last thing, but what do you see?
Yeah, well, just expanding a little bit more, I'd come back to what our mission is, and so it's united community, empowered people, and exceptional health. And one of the core things in that is one of our values, which is relationships. And so, you know, as Darrin and Scott both said, you know, collaboration. You hear that word a lot. So, you know, we're going to collaborate, we're going to partner, but it ultimately, fundamentally comes down to the relationships. And so how do we build stronger relationships? And I think we start with, you know, our culture. You know, I think we have a very good culture. My focus is how do we make it even better? You know, how do we strengthen, you know, the health of those relationships with each other, and I would say even ourselves. You know, people, you know, the community, our employees have gone through a very traumatic, you know, time over the last 12 months, and so there's going to need to be a lot of healing, and so, you know, that's part of how do we do that in a way that, you know, brings compassion and empathy, you know, for ourselves, for each other, and so I'm very focused on, you know, continuing to find ways to strengthen and improve our culture. Take care of our people, take care of the community. So really, it's going to be about relationships. And then as we take care of those things, then all that other great stuff, really cool stuff, fun stuff that I talked about, I think we can really you know, continue to springboard on that, because again, I think there's a lot of ways that we can continue to serve you know, the community and expand you know, the needs of the community. But again, Darrin, you know, nailed it. You know, it's not going to be us on our own. You know, in most cases, we'll be looking at how do we partner with folks and create those right kinds of relationships that can better serve the community.
Okay, gentlemen, I appreciate the time. I'm going to give Scott last word. Do you have a last statement?
Last statement. Great hospitals are staffed by great people. And we've got those great people underneath that roof. I've been honored to go ahead and work beside them during these last 10 years. I wish them well, and I'll be looking forward to what their next accomplishment is in the near future.
Okay. Thank you, guys.
I want to thank the officials from Mason Health for arranging this interview with Scott Hilburn, Darrin Moody, and Eric Moll. I'm Dietrich Allen.
Thanks for watching Mason Web TV, powered by HCC.